Hello, today welcome to another episode of our health tip. Today I'll be talking about erectile dysfunction. What is erectile dysfunction? This is a common condition that happens in men. It's a condition in men. What are the presentations? One, they find it difficult to have an erection, and the second one, they find it difficult to sustain an erection. So erectile dysfunction is a problem or a condition in men whereby they find it difficult to have an erection and also find it difficult to sustain an erection. And these are the major symptoms. One, you can't have an erection. Two, you can't sustain an erection. And then the third one, they tend to have less flair or tend to avoid sex in general. Those are the major symptoms of erectile dysfunction. This happens in majority, many men, let me just put it that way. And 80% of individuals that have this condition finds it difficult to discuss with their partner about their problem, nor even tell their medical professional because they are so embarrassed. You don't need to be. Because when you seek medical advice in time, you can be able to get the cure or the solution to your problem. Now, what are the major causes, the common causes of erectile dysfunction? We have the physical cause of erectile dysfunction, what we call the physical cause. The first one is heart disease. It can cause erectile dysfunction based on the complications. The second one is high cholesterol level. The third one is high blood pressure. The next one is diabetes. The next one is obesity, increase or, extra large obesity can cause erectile dysfunction. The next one is Parkinson's disease. The next one is multiple sclerosis. Multiple sclerosis and Parkinson at times tend to be what we call the autoimmune condition, whereby your body produces antibody against itself. All right. Then the next one again is tobacco use. The use of tobacco can also cause what? Erectile dysfunction. Then the next one again, alcohol. Overuse of alcohol. At times, when you are taking alcohol, you feel like you are getting high. But when you get to that point where you are drunk to stupor, depression comes in. So, overuse of alcohol causes what? Erectile dysfunction. The next one is hormonal. Low level of testosterone can also cause what? Erectile dysfunction. All right. Then the next one again is the mental cause of erectile dysfunction. The mental cause when it comes from the brain. Number one, depression can cause erectile dysfunction. When you are not concentrating, when there is a lot going through your mind and you notice that you are down completely emotionally, depression can cause erectile dysfunction. Anxiety can cause erectile dysfunction. That's why when someone comes in with erectile dysfunction, they'll first of all give you the form called the DAS21 form for you to fill to check what your stress level, your depression level, and your anxiety level. Stress can also cause erectile dysfunction. And last but not the least, when it comes to the mental one, you talk about the problems with partner. These can also be factors causing erectile dysfunction. Then next one again are the risk factors. What are the possible things that can also cause erectile dysfunction? One, when you advance in age, when you get older, at times you can also come with what? Erectile dysfunction. Like I mentioned before, medical conditions, diabetes, heart conditions, and all that are risk factors. Tobacco usage, those are risk factors. Overweight, those are risk factors. Some medical, some drugs that you take. There are some type of drugs that you take that also cause what? Erectile dysfunction. For example, the antihistamine, antidepressant. When you're taking an antidepressant, that means the person is depressed. That is the mental part. All right. So those are the drugs that can also cause that. Then, like I mentioned before, use of illicit drugs and tobacco, those are the things that can also cause erectile dysfunction. What are the complications coming from erectile dysfunction? Complications. Number one, you have a poor sex life. You tend to shy away from sex, both from your partner and even from your wife. And that's a very, very, bad condition. Yeah. Because who believe that sex at times tend to make individual that are in the relationship to bond well. That's a major problem. The next one again that can also be as a complication from erectile dysfunction is depression. You will see a man, he will not want to hear about sex again because he don't want to embarrass himself. And at times he get called names, 2 minutes man, 1 minute man. That's not wonderful. It gives them anxiety. And also it gives them palpitation. When there's an anxiety, you can also have palpitation, and then it gives them stress. Those are also part of the complication. Then the next one again also brings relationship issues, embarrassment everywhere. And also then the final one, you won't be able to get your partner pregnant. Those are all complications coming from what? Erectile dysfunction. Now, let's move over to how you can be able to prevent this. If you have diabetes, if you are diabetic, you are hypertensive, you have a heart condition, you have ongoing medical condition, see your medical professional. If you are having the symptoms of erectile dysfunction already, seek medical advice. Go to the hospital. I don't mind, you can drop, a message in my DM. I will respond to you. I will guide you and I'll tell you how we can be able to help you out. The next one again, smoking. Avoid or stop smoking. It will also help you to stop or maybe to limit or cure or prevent erectile dysfunction. Exercise on a regular basis. Exercise on a regular basis. I mentioned before in my past post where I mentioned you should be able to at least complete 5,000 steps every day. That will help a lot to also prevent erectile dysfunction. Be physically fit, increase your endurance, and also increase your physical activity. I will stop here for now so that I won't bore you guys. If there's any question, slide to my DM, drop your messages, and I will respond to you. Thank you, and see you on our next episode. Bye-bye.